Good morning. Thank you for joining us here today for an update on the Health Human Resource Action Plan and in particular our government's recent mission to the Philippines. Before we get to questions, we will each provide brief remarks on the absolute success of the mission. As you know, our Health Human Resource Plan aims to retain, train, and recruit healthcare staff across the province and strengthen the healthcare system for Manitobans. As part of the recruit pillar of our action plan, our government recently sent a delegation of Manitoba healthcare leaders from across the province, as well as a number of members of Shared Health Recruitment Team, to the Philippines to attract additional registered nurses, licensed practical nurses, equivalents, and healthcare aides to our great province. That delegation had one message: Manitoba is a destination of choice for trained healthcare providers from around the world. Our province is well positioned to provide internationally educated healthcare providers a great place to call home. During this mission, I'm happy to state that healthcare service delivery organizations across Manitoba provided nearly 350 letters of intent to already trained healthcare professionals, including nearly 190 registered nurses, 50 licensed practical nurse equivalents, and 110 healthcare aides. This significantly exceeded our goal and expectations, and I look forward to welcoming those healthcare professionals into the health system here in Manitoba. My colleagues who are in Manila will speak more to the desire to come to Manitoba, but I will say this: Philippine healthcare professionals want to come to Manitoba. Our government committed to providing a welcoming, streamlined, and reasonable process to ensure that internationally educated healthcare providers are able to practice their passion and excel in our healthcare system. Nurses are an incredibly valued member of the healthcare workforce who provide critical services under sometimes extraordinary pressures. That is why the Philippine mission is just one of over 30 initiatives our government is implementing with the goal of hiring 2,000 new healthcare professionals. And I want to highlight that recently our government worked with the College of Registered Nurses of Manitoba to improve 7 pathways for internationally educated nurses and retired nurses right here in Manitoba who are looking to enter or re-enter our system. Examples of this include a new English language proficiency, providing a second attempt at clinical competency assessment, conditional licensing, and expanding the undergraduate nurse employee program to include internationally educated nurses. Additionally, our government recently announced 9 incentives to retain nurses, including full-time, remote, and weekend incentives. All of these incentives are part of our government's $200 million commitment to add 2,000 healthcare professionals to the health system. Our government recently also announced multiple initiatives to retain and train doctors, including implementing the Virtual Emergency Care and Transfer Resource Service, or fondly known as VECTORS, working with Doctors Manitoba to reduce doctor administrative burdens, and adding 80 new doctor training seats. And we look forward to providing additional updates on other incentives as they are finalized. Our government is strengthening healthcare, investing in healthcare professionals, and building our human resource capacity right here in Manitoba. Thank you all for joining us today. I'll now pass it to my colleague, Minister Reyes.
Thank you. Good morning, everyone. Bon après-midi. Magandang umaga po sa inyong lahat. The Philippines mission was a success. First of all, I just want to thank our Premier and thank Minister Gordon for allowing me to lead the Manitoba delegation, along with the Executive Director for Cancer Care Manitoba, Ken Borsay here, also of Filipino descent. You know what? This trip was special for me, Ken, and the delegation who were of Filipino descendant. For me personally, I guess when I was talking to my sister, This trip was full circle for me. My dad immigrated to Manitoba in 1968, and we've had a long history with the Philippines with respect to migrant workers. Yes, we do have a memorandum of understanding that was created in 2010, but I can tell you, someone who's a proud Filipino Canadian from Manitoba, who has the largest population per capita in all of Canada with respect to the Filipino community, I can tell you that we've had a long history of migrant workers coming to Manitoba since the late 1950s. And fast forward, to go on this mission to represent our province gave me such a great pride and joy to see many of our kababayans, compatriots, which we say in the Filipino language, travel from 8 hours away or 5 hours away after a night shift coming for this interview. And the success that we had in attracting these internationally educated professionals, which will be making Manitoba even more friendlier with more internationally educated professionals from the Philippines coming here. I was very proud. I know that we were there for only 5 days, but I'll tell you, my schedule is very packed, meeting with government officials, visiting a hospital and colleges. I can tell you it felt like 2 weeks, but I don't regret it one bit. And again, I want to thank our Premier, Minister Gordon, for allowing me to lead the Manitoba delegation on behalf of the province and being alongside great folks like Ken Borsay, who I'll give you the floor now to explain more of the trip there, Ken. Thank you.
Good morning, everyone. My name is Ken Borsay. I'm a registered nurse, a healthcare leader, and the Chief of Clinical Operations at Cancer Care Manitoba. I was also privileged to participate in Manitoba's recent health recruitment effort in the Philippines, which focused on recruiting highly educated nurses to join us here in Manitoba's healthcare system. During my time in the Philippines, I'm very delighted to speak with many nurses looking to build their dreams in Canada. Over the course of this trip, I was able to share my story of success of being educated in the Philippines, coming to Manitoba, and becoming a healthcare leader in our province's health system. The high-quality nursing education that I received from the University of Santo Tomas in Manila set me on the path that has allowed me to achieve great success in Manitoba. When I arrived in Manitoba, my main focus was to get my credentials recognized by the College of Registered Nurses of Manitoba. This was a very rigorous process because it aimed to protect Manitobans by setting and upholding the standards of nursing practice. After several months, I successfully obtained my Manitoba RN license and started my career. My first nursing job in Canada was at Manitoba's largest hospital at the Health Sciences Center in Winnipeg. I started in acute medicine, and from there, completed further education to work at HSC's critical care program in the surgical intensive care unit, where I provided critical care nursing to trauma, neurosurgical, surgical, and burn patients, some of the sickest patients in the province. In addition to my clinical experience, I also had the opportunity to work in the university as a clinical education facilitator for third-year nursing students from the University of Manitoba, a role that allowed me to teach and facilitate the application of theory into clinical practice. Since then, I've been privileged to work in various clinical, leadership, and volunteer roles. Throughout my career, I've always believed in doing my ordinary duties extraordinarily well with compassion, commitment, and competence. These are qualities shared by many Filipino healthcare professionals, including those who traveled long distances for the opportunity to meet with us during the interviews in the Philippines. Over the course of 5 days of interviews held in Manila, Cebu, and Iloilo, our teams interviewed nearly 400 nurses. The applicants were pre-screened for a number of requirements that make them ideal for roles in our healthcare system. These included a bachelor's degree in nursing, a minimum of 2 years worked in either acute care or care of the elderly, and a preference for those who had already completed the necessary English language requirements. Nurses who meet these criteria were scheduled for interviews with members of our clinical and HR teams, and then participated in an immigration briefing about living and working in Manitoba. Participants also had the opportunity to connect with our partners at the University of Manitoba to talk about the clinical competency assessment, a component in becoming a registered nurse in Manitoba. The nurses were categorized into 3 pathways based on their education, experience, and interview. These included the RN or IEN UNE stream, the LPN or SIEN stream, and the healthcare aid stream, all of which are needed in our healthcare system today. We are extremely pleased with the quality and qualifications of the candidates we met and offered the vast majority of applicants a letter of interest for employment, moving them to the next stage in the process. These nurses will now receive follow-up contact to confirm the next steps in their individual journey to Manitoba. These may include an immigration interview, confirmation of English language requirements, or discussion of the timing of their clinical competency assessment. While each of their journey will differ slightly, the support and warm welcome they will receive when they arrive here in Manitoba will not. And we spoke about that at great length with the many applicants that we met. Many of them actually have family already here in Manitoba. Others are looking for an opportunity to come to Canada to build a life for their children, similar to the decision that my parents made over a decade ago. My professional journey is one of Manitoba's many success stories of internationally educated health professionals that are contributing and leading in our healthcare system today. It is also a testament that success is possible with perseverance and support from family, friends, community, and professional associations. This trip is a humbling experience for me, connecting with our kababayans or fellow Filipinos in the Philippines. I look forward to being a resource and a mentor to nurses keen on building their dreams and achieving their professional goals here in Manitoba. Thank you.
That concludes the formal part of our update post the Philippine mission. We are all open to questions at this time. So, as you know, Manitoba and Canada, for that matter, has as Minister Reyes mentioned, a long-standing cultural tie to the Philippines. The MOU dates back to 2010. It's been in place for some time now, and it's very much a give and take relationship. And so we are in talks at the moment with the Philippine government as well as the Canadian government on how we can give back to the Philippines. But I also want to remind you that this is just one of 30 initiatives under the Health Human Resource Action Plan and under this particular recruitment pillar.
You are, I'm sure, familiar with my colleague Karen Paul's story about some folks that come over from Philippines and said that they actually felt that they couldn't even actually work here, and even though they would qualify under the criteria. So what would you say to the fact that we haven't even fully tried to train up and utilize the healthcare workers who've already come from the Philippines?
What I would say to that, Bartley, is that it was our government that made the commitment to provide up to $23,000 to internationally educated nurses through a portal that is in the Economic Development, Investment and Trade Department. Under that $23,000, individuals can access those funds for a number of supports. We've also just recently worked very closely with the College of Registered Nurses of Manitoba to modernize the pathways to allow for individuals who are currently internationally educated nurses right here in our province to go into the health system as undergraduate nurse employees while they continue their Bridge-In program, continue their language training program, and are able to immediately give back to the health system.
More to Rosanna's question, what happens if every country and every jurisdiction in the world keeps going to developing countries or less developed countries and sending their trained up people? What does that say ethically about our actions?
Well, what I want to talk about is Manitoba. I don't think I should be the spokesperson for other jurisdictions in the country. What I do want to say is that our agreements are done based on labor laws. They are negotiated memorandum of understanding agreements with the countries that we have been talking to, including the Philippine mission. And they respect the labor laws and the requirements of that government and that country in terms of the number of individuals who are allowed to leave their country. Manitoba has always been a welcoming place. I am an immigrant. I was born in Jamaica, came here when I was 5 years old, and like Ken said, my parents wanted to come here to give us more opportunities. And I'm one of the success stories of immigrants who've come to Manitoba, made Manitoba their home, and has succeeded in terms of seizing those opportunities and making good of them. And we want to continue to be a welcoming place, not just for the nursing profession, but for other sectors, and to continue to keep Manitoba friendly and allow for individuals who want to migrate and take advantage of living in different places across the world. And if it's Manitoba, we certainly want to be welcoming and make that happen. Sure, it's hard to.
So just as a follow-up question to this, you talked about a give and take relationship. So what is Manitoba giving to the Philippines?
Well, we're certainly given the opportunity for individuals who want to migrate and want to come to Manitoba an opportunity to do so. Recently, I was actually in a meeting with the municipality of Hamiota, and they shared with me that 10 families under the family referral program under this mission, 10 families put forward names of family members they have in the Philippines who are interested in family reunification and coming here to the province to work in the health system. So we are giving back in terms of being a welcoming place for newcomers and ensuring that we have mentorship programs available for those individuals, that individuals are able to work not just in Winnipeg, but in rural and northern communities, and ensuring that as we move into talks with the Philippine government and our federal government on ways that we can support their population, that we remain open to all the opportunities that become available.
Nurses have been raising concerns about current working conditions at Manitoba's largest hospital. Overcrowding, staff shortages, they're stretched thin. On Monday night, we had a patient who passed away in the hallway waiting for care. So what does that say about the state of the current healthcare system?
Well, that is, I first want to start by thanking the nurses that have been at the bedside on the front lines during a very difficult time in our province's history, and it was during the pandemic. And I had the opportunity to sit down with those nurses at HSC, at the Grace Hospital, and at St. Boniface, and we had open and honest dialogue, and they shared with me what they thought we needed to do as a government. And we responded with a Health Human Resource Action Plan, which is the largest single investment in the province's history in the health system. It was the nurses that talked to me about the incentives they thought we needed to develop. And we have answered their call by developing those incentives. The weekend premiums, the remote travel allowance, the refer nurse program, those all came from the front lines. And we recognize the pressures on the system, not just at HSC, but at the community level and at our other acute care facilities, and we are responding. The college is responding by modernizing their pathways, by streamlining their pathways so that we can get more health professionals into the system. And I want to congratulate them on the newest incentive for undergraduate nurse employees, internationally educated nurses, to be able to go into the system while they continue their bridging programs, their language training programs, and as well the college has made it possible for the internationally educated nurses to have their English language qualified by healthcare professionals as well. I mean, these are significant changes which will add more health professionals to the system. So I say to the nurses, and to all the health professionals who are working very hard during this time. I appreciate your commitment, you're valued, you're appreciated, and our government is responding in meaningful and proactive ways.
Minister, after the death of Brian Sinclair, there were supposed to be new procedures put in place to prevent people from dying in similar ways. Is that what happened here? Did the procedures not work, or what other failures allowed another death like this to happen?
So again, I want to thank the health professionals that are working at our largest hospital and for their commitment and their dedication. I understand from Shared Health that an investigation is underway, and I cannot speak to the specifics of any one case due to protection of privacy legislation, but I will say an investigation is underway, and I look forward to receiving the results of that investigation. Over to you. What has gone up?
The wait times for
Okay.
ambulances in Winnipeg gone up more than 5 minutes since 2019. Are there more ambulances?
Well, I will say that the budget 2023 will have a lot of good news, but I also want to highlight that it was our government that reduced the ambulance fees in this province from $500 to $250. We cut it in half. We are adding paramedics to the system, 35 new paramedics. We've added seats to the paramedic program at Red River College, and more good news is on the way for our EMS staff and health professionals, and so stay tuned in the budget next week. Bartley.
Emergency wards have been acting as overflows for medicine wards in the hospital for well over a year now. And you spoke about incentives earlier to get more people to the system, but what immediate steps are you going to take so that people can have the confidence to go to emergency and have the confidence that they're going to get care?
So I want to assure Manitobans that our emergency departments, if they do need assistance, they feel they are experiencing an emergency episode, that they should call 911, they should go to the emergency department. We are going to continue to work with Shared Health, the health system leaders, to ensure that individuals are streamlined, that Bartley, you saw the billboards all over the city. We talked about that last year in terms of educating individuals about where they should be for the right type of care that they need. And we're going to continue when they just a moment, don't interrupt, please, when they come to the emergency department, to ensure that they are triaged and allowed to make decisions about where is the best place for them to receive the care that they need.
All right, thank you very much, folks.
Thank you.
Could you please address that? The doctors and the nurses, they say that it isn't patient flow. Oh, you can't do that. Yeah, right here. Good.
Just a second.
Sure thing.
Want to get in there?
Sure.
Just stand in front there.
Pardon me? I'll just do this. How am I out of? Stand right here? Okay.
Yeah, yeah.
You have a lab, you just click on it.
You know what? Just type.
Oh,
Do you have tape? Do you have any electrical tape?
you can use
This is fine. This will be. What do you guys just want to do a bit of? Yes, please. You can just go to the side.
right here.
Dougal, do you mind just coming a little closer?
Yeah, I know. No, for sure. I'll stand wherever you want me to do.
Do you mind if I pull your mic?
Do whatever you gotta do, yeah.
A tiny bit.
No, it's fine.
Okay. Am I in anyone's shot? Okay, thank you. First of all.
Yep.
Oh, sorry. Do you have any opening remarks? We just go ahead.
Well, no, I'll just start with the recent announcement. Look, the announcement that they're going to try to find 2,000 people in the Philippines is it's a huge ethical problem because the Philippines is facing a shortage of nurses, but this is an identical plan to one that the PCs rolled out in 1999. They went to the same places, and it didn't work at the time. They said, well, we're going to find 400 nurses and we're going to bring them back. They ended up bringing 20 and only 6 ended up staying. They sent people it was exactly the same thing. And this is a story from the Free Press. February 28th, 2000. So it's a year ago, 23 years ago, a year ago yesterday. Hire us first, Filipino nurses here demand. Is that there is enormous capacity in the system to actually get people who are living here and who are qualified as nurses and doctors who could be working in the system who aren't. The reality is they're being driven out by the way this government and the NDP before them actually have treated nurses. They've had to work for years and years without any supports. They don't get breaks. They're forced to do mandatory overtime, and when they become managers, and they protest and complain. Look, whatever is, and then they say, look, what's happening is not safe for a patient. They get fired because they're not part of a union anymore. We've heard about cases at the Grace Hospital where there are nurses who've had 8 managers in 8 years because when people speak up, they're fired. When people complain, they're threatened or forced to sign an NDA. We're hearing that that nurses are facing all sorts of unnecessary discipline and not getting the support they need. So the idea that we're going to bring 2,000 nurses from the Philippines, where we absolutely do not have the capacity to train them up, and I think it's a pipe dream. I think it's verging on a swindle for the government to suggest that this is a plan that's going to work, while we're completely ignoring not just the chaos in our hospitals, but the fact that there are many, many people who are perfectly qualified to work here in Manitoba who are unable to work in the system because of this government's incompetence and because of their inability to get people trained.
Speaking of chaos in hospitals, what specific means could you do, or would a Liberal government do, to actually get that emergency wards stop functioning as these overflows and get more people working in medicine wards, get patients into hospital?
Again, so there was a prediction 6 years ago from an expert said shutting down ERs is not going to work because the problem is that ERs are being backed up because there's no beds. I spent 6 hours in a hallway and another 19 in the ER at the St. Boniface Hospital. The terrifying thing about being stuck in a corridor, there are no bells. If there is no one else to call for help for you, you will get no help. I had to be the person calling for help for several seniors in wheelchairs who needed help just getting to the bathroom, who couldn't speak up and be heard. So if you have a patient who's in distress in a hallway, there's no one listening. That's a terrifying prospect. And I keep hearing from people across Manitoba, in Winnipeg, in rural Manitoba, in the north, they're praying that they don't get sick and that they don't have to go to a hospital because they don't think they're going to be safe there. So this is some family's worst nightmare. And the idea that this is going to be solved with a happy budget announcement next week is not the case. We need to let people be free to speak about what's really happening there. We have to listen to nurses and doctors. We have to make sure that they're being taken care of because there are people who are willing to help, but this government won't let them.
Well, what would you do any differently?
Well, the first thing actually, the number one thing actually I've taught is that we have to be able to free people up to speak. And that really does make a difference, and they need to be listened to. We need to have nurses who are in managerial positions, who are actually nurses. We need to be bringing people back into the system, and we need to add beds, not just in PCHs, but also in hospitals, to actually make sure that people have can get out of the ER, because the ER is just a holding room at this point. I mean, it isn't just patient flow, but it's also because we've completely broken things down, because we have to work. There are a whole series of policies that
can be brought in to bring people back into the system right now, but we have to guarantee people that they're going to be taken care of, that they're not going to be abused, and then they're not going to be silenced.
An ad campaign right now that basically tells people where they should be going, urgent care, not care. I think a lot of people know when they got broken bones or they've been hit with a car, by a car, they go to a hospital. What do you make of the message that's being sent to people saying, suggestion here that it's to some degree Manitobans' own fault that they're going in the wrong place and that's somehow impacting care?
No, it's absolutely disgraceful, because the whole thing, it's also because there's nowhere else to go. If you've closed closed urgent cares, as this government did, if you closed access clinics, as this government did, and if you don't actually pay family doctors properly, one of the things is to actually provide family doctors with flexible pay so that people can go and see them, and actually involve nurse practitioners. There's all sorts of people, and I keep talking to them, and they're not even working. They want to work in the system. They are trained here in Manitoba, but they are being blocked from doing it, either by bad management or by an incompetent government that hasn't done enough to work with colleges to make sure that these people can get the training they need. I've talked to Filipino nurses who are enraged about this trip. It's a junket to the Philippines because they are sitting waiting, well, why can't I get work? And the other is that we have to pull people back. We have to reduce the number of people who are working for agencies and pull them back into the public system, but that's only going to work. And we have to, because you know what, some of those agencies are really price gouging, and that's an issue as well. So.
Sir, in response to the patient who died in the HSC, the hallway, is this a systemic issue in your opinion?
Absolutely, but it's a systemic issue that they've been warned about. This is a government that, during the pandemic, went through 2 rounds of massive deletions and layoffs, firing more people and getting rid of more and more people because they were trying to save money in the middle of the biggest public health crisis in a century. And it has been all about saving money, and it's been too focused on that, and it's not at all focused on patient care. It is absolutely a systemic issue because there have been ER closures. And look, and some of this is because, I'll add one other thing, what you need in an ER to run an ER is a lab. The people who work for it's the Manitoba Alliance of Healthcare Professionals include labs. They haven't had an increase in 5 years. People in home care have not had an increase since 2018. You have nurses who left because they weren't getting raises despite. We're not taking care of the people in the public health system. We're not even paying them. We're not making sure that it's a terrible place to work. And it's a terrible place to work where the workers who are there are being abused. So we have to stop abusing them and start helping them and caring for them, because they're burning out, because they're being treated horribly by this government, by the RHAs, and by management. That's whose fault it is. It's not patients.
Would you have anything to add about the accreditation processes that have been improved to? So that's what we're being told, I guess.
Well, the key thing is it's not just we keep hearing from nurses that doesn't help. I mean, and the college has been extremely. They just haven't gotten it up to this point. But the other thing about it is that people actually need to be able to pay for those things. So you say, well, we're going to invite a nurse here, and then how are they going to support themselves? How are they actually going to be able to pay for themselves as they work their way through? And we need to be able. We already have a problem with that, and we need to make sure. Like, we have specialists from Ukraine who aren't able to practice here. Nurses, doctors from Afghanistan, from the Philippines. They cannot practice here because the colleges don't and the government don't have their act together. That's something that's a major priority that would actually get people into the system faster.
Français, s'il vous plaît.
Wait.
Catherine?
Wait.
Which camera do you have your own?
I think Fern is here, or I can
Okay.
use the CDC one.
Wait. Okay.
Yeah, you can look.
Okay. Est-ce que vous devez commencer par demander des questions ou?
Peut-être
Oui.
commencer par. Je savais pas que vous parliez français, mais.
Oh, oui.
Donc,
Oui, je suis le député de Saint-Boniface, n'est-ce pas? Oui. Le chef du parti. Oui, excellent.
donc c'est ça, je voulais savoir, c'est
Oui.
quoi vos commentaires sur l'annonce aujourd'hui, premièrement?
Ben, je pense que vraiment, ce qu'il propose, c'est identique à un plan qui n'a pas marché en 1904, ça fait 24 ans, où ils avaient un voyage aux Philippines pour chercher des infirmières. Mais à ce temps, ça n'a pas marché. Et je doute encore que ça va marcher aujourd'hui. Mais le voyage était identique, les mêmes promesses, mais c'est un peu plus grand. Mais enfin, ce qu'ils ont fait, en 1999, ils ont dit on va chercher 400, maintenant c'est 2000. Mais ce qui s'est passé il y a 23 ans, 24 ans, ils ont seulement trouvé 20 personnes et enfin, il y a vraiment 12 ou 6 qui sont venus. Et même qu'ils travaillaient un peu au nord ou au rural, ils ont tout parti, soit pour Vancouver, Calgary, Toronto. Alors, on ne veut pas encore, on veut attirer les gens, mais on aussi veut garantir qu'ils vont rester ici. Et il y a plein d'infirmières, de docteurs et d'autres gens qui veulent travailler dans notre système de santé ici, au Manitoba, maintenant, mais qui ne puissent pas parce que ce gouvernement a créé du chaos et c'est impossible pour eux, soit parce que c'est un environnement toxique, ce qui est un problème, mais aussi parce qu'il y a eu tellement de compression et de coupures. Alors, je doute que ce plan va marcher. Je pense que c'est une grande promesse, mais vraiment, pour vraiment dire, on va tout résoudre ce problème de manque d'infirmières. C'est aussi un problème parce que les Philippines, ils ont un manque d'infirmières aussi. Alors, si on va dire, on va aller à ce pays et prendre 2000 de leurs infirmières, ils vont perdre et prendre de leur système de santé. C'est une question morale. Mais on a la capacité de le faire ici. Ça va peut-être prendre un peu plus de temps, mais il faut faire la bonne chose et non pas seulement d'avoir ces idées comme ça qu'on va aller chercher des infirmières tout à part. Parce qu'il y a des gens, on pourrait les entraîner, on pourrait assurer qu'ils ont toutes les qualifications, mais le gouvernement n'a rien fait jusqu'à aujourd'hui. Alors, c'est beaucoup plus tard et au même que ça, je ne sais pas que le plan qu'il propose va marcher.
Puis vous avez parlé aussi du fait que vous avez eu à faire une visite à l'urgence tout récemment. Est-ce que vous pouvez me parler un peu de cette expérience-là?
Bien, ce qui s'est passé au Health Sciences Center, c'était tellement tragique. Et c'est terrifiant parce que si tu te rends à une salle d'urgence et s'il n'y a pas de place, tu es dans un corridor et il n'y a aucune méthode d'appel. Tu es là tout seul et la seule façon, c'est vraiment de crier. Alors, j'étais là pour 6 heures parce qu'il n'y avait aucun lit dans l'urgence. Il fallait que je crie pour des aînés qui avaient besoin d'aller aux salles de bain, qui avaient besoin d'aide, et c'était à moi parce que si je n'étais pas là, de crier pour prendre l'attention de quelqu'un dans une autre salle à 4 heures du matin. Et ensuite, j'étais pour 19 heures dans la salle d'urgence parce qu'il n'y avait pas de lit. Alors, il faut ouvrir les lits, ouvrir plus de lits pour qu'on aide à bouger, mais aussi c'est essentiel. Ce n'est pas une question de dire, mais le problème, ce n'est pas le problème que les Manitobains ne savent pas qu'il faut aller aux salles d'urgence. Il faut avoir d'autres endroits à aller parce que souvent, c'est le seul endroit. Alors, on est là, ça peut être là avec quelqu'un qui a une crise cardiaque, quelqu'un d'autre qui a été dans un accident d'auto et quelqu'un d'autre qui a coupé leur doigt, comme je l'ai fait une fois. Alors, s'il y a d'autres options, mais il faut investir pour faire mais il faut aussi, un des plus grands problèmes de la crise de notre système de santé, c'est que les gens ne peuvent pas parler. Les gens dans le système de santé sont interdits de parler, même et s'ils parlent, ils sont punis pour le faire. Et ça, c'est la chose la plus grande qu'il faut changer. C'est une question de culture, mais c'est le problème avec le gouvernement et aussi avec la gestion et les soins partagés. Ça ne fait aucun sens.
Deux questions pour répéter un peu ce que vous avez dit.
Oui.
Là, c'est plus pratique pour nous. Donc, qu'est-ce qu'un gouvernement libéral ferait pour remédier à la situation?
Bien, on a toute une plateforme qu'on développe, mais on veut augmenter pour commencer, il y a toutes sortes de gens qui ne sont pas bien payés dans le système de santé et qui ont besoin de meilleurs bénéfices. Ils sont déjà là. Ils partent parce qu'ils ne peuvent pas payer leurs factures et ils ont des crises de santé mentale à cause de leur travail. Alors, on va donner leur soutien, donner plus de soutien aux infirmières, surtout avec les garderies. Ça aiderait beaucoup. Et d'assurer que la santé mentale est quelque chose pour aider parce que maintenant, les infirmières n'ont rien. Et pour le burn-out, il n'y a rien. Alors, on perd des gens qui pourraient retourner dans le système de santé parce qu'on ne prend pas soin des gens qui prennent soin des autres. Alors, ça, c'est l'autre chose qu'il faut faire. OK, de rien, merci.
Take that back. We got Rob coming in. he speaks French.
No, I knew about Bob, but I didn't know about it. Thanks.
Probably. You asked a question in English. I was like, all right.
No, thank you. Je sais que je suis là. Oui, ça je savais. Je savais pas pour lui.
Everyone, again, everyone's white.
Sure, it's good. Okay, I want to begin by acknowledging that there is a very concerning situation with somebody dying in a hallway at the emergency room at Health Sciences Center. And I want to offer my condolences, my sympathy to this person, and my deepest condolences to their friends and family. We don't yet know many of the details about what took place here, but we do know that we have an issue in our emergency rooms across Manitoba. After all of the challenges with cuts and the pandemic, we have seen that we need urgent attention to support the nurses, healthcare professionals, physicians, and healthcare aides who are delivering life-saving treatment on the front lines of ERs across the province. And as part of fixing our healthcare system, we need accountability. We cannot have those running our healthcare system running away from questions. We need to be able to get answers, because Manitobans deserve to have confidence when they go to an emergency room that they are going to get the health care that they're seeking.
What would an NDP government do any differently? What could you do right now to deal with the fact that the ERs are serving as overflows for the hospitals?
I think we would begin by resetting the relationship with those who work in healthcare. After so many years of disrespect and stress and alienation at the hands of the Progressive Conservative government, it's certainly time for us to have a positive working relationship with those healthcare heroes and to deliver not only work-life balance, but a sense of mission and meaningful work to those people who are going every day to the emergency rooms and to the ORs and to the wards in our healthcare system. And beyond that, of course, we know that we have to invest in personal care homes, home care, and of course to expand the primary care options for Manitobans who just want to see a family doctor. So there's a lot that we have to do on healthcare, and certainly our team is looking forward to holding this government accountable in this coming legislative session, which begins this afternoon, but also in putting forward a plan for you as Manitobans, that you know that your next government will actually get to the task of fixing healthcare in Manitoba so that it's there for you when you need it.
With all respect, how does respect get more staff immediately into hospital beds?
Well, healthcare is a human enterprise. It's run by people. And when people feel disrespected on top of feeling tired and burnt out, that's when you see people leaving the jobs that are currently being left empty, that are currently seeing people quitting, particularly at a time when we can least afford it. And let's be clear, the people working on the front lines of our healthcare system are doing heroic tasks, are doing heavy lifting. I can tell you that people feel the personal impact when the patient doesn't get the care that they need, when the outcomes are not what the nurse or physician wanted to deliver. And so we, as elected leaders in the province, have to match that commitment with a similar task of improving the healthcare system. People are going to work every day on the front lines. It's time that there's a government in place in Manitoba that matches that commitment and that 24/7 effort to improve healthcare for you, the people of Manitoba.
The health minister suggested patient flow, knowing where to go, is part of the problem. What do you make of that?
Well, I think that Manitobans expect when they show up at an ER that they are going to get the health care that they need. It's that simple. If you show up in an ER, you should be cared for. And that's what folks who work in those centers want to deliver. And any elected official in Manitoba should be matching that commitment and certainly not running away from accountability questions.
Just before, Francais, can we ask any reaction to the Philippine trip announcement this morning?
Well, we would certainly welcome more internationally trained nurses here in Manitoba. I think we all know that we need more people working at the bedside. But we cannot forget that there are many internationally trained nurses, healthcare professionals in the province right now who are having difficulty getting to work at the bedside. Not to mention that there are retired nurses who spent their entire careers practicing in Manitoba who are not able to return to the bedside. And so certainly we would want to see more people coming to the province to help on the front lines of the healthcare system, but let's also get those folks who are already in Manitoba with the necessary skills and experience, let's get those good people to work as quickly as we can.
Would you bring in a seniors advocate, and how easy would that be?
I think a seniors advocate is something that you could do very, very quickly. It's an idea that we would implement within the first 100 days of forming government here in Manitoba, and it's needed. When we're moved day after day by stories of seniors struggling in personal care homes in conditions that none of us would want for our loved ones, when we hear about issues with home care that are absolutely heart-wrenching, I think we all know that we should be delivering better for seniors in Manitoba, and to have an independent voice standing up for seniors in the form of a seniors advocate is one way that we could not only deliver those services, but ensure that any government here in Manitoba going forward would be held accountable to delivering dignity for seniors in our great province.
Last chance to offer something concrete to deal with emergency, besides respect and training and feeling.
When we form government in Manitoba, should we earn that right from the people of this great province, I think one of the first things we will do is reset the relationship with nurses, healthcare professionals, and part of sending that reset and that message of respect to those folks on the front lines will be to implement healthcare leadership that has a high degree of emotional intelligence, that would be able to listen and validate the concerns of those working on the front lines, to run those up to other levels of the healthcare system where changes need to be implemented, but also to communicate and bring people along. The last thing that we need right now in healthcare is alienating more nurses and folks on the front lines, losing more people from their jobs. We need to be able to implement a strong plan and hit the ground running immediately in this province. And part of that does mean a change in healthcare leadership as it pertains to emergency rooms and other parts of our healthcare system. Oui?
Okay. Thanks. Can I give you my
Yes, of course.
Just my best.
And
Yeah,
put it
thanks.
on my
Yeah, thanks. So my turn in French. If you could just comment, en français, pardon. Donc,
Ouais.
Est-ce que vous pourriez faire un petit commentaire sur l'annonce qui a été faite aujourd'hui au sujet du voyage de la mission aux Philippines?
Bien, on a besoin de plus de personnes qui travaillent dans le système de santé, mais il y a beaucoup de monde ici dans le Manitoba qui ont déjà déménagé ici, qui habitent ici déjà, qui n'ont pas réussi à trouver un travail dans le système de santé. On devrait travailler pour eux et puis aussi pour les infirmières qui ont déjà pris leur retraite dans la province, qui veulent travailler dans notre système. Oui, on pourrait ajouter plus d'infirmières qui viennent des autres pays, mais il y a déjà des mondes ici et on devrait travailler avec eux.
Puis sur la question éthique d'aller chercher des travailleurs dans des pays moins fortunés peut-être que le Manitoba, qu'est-ce que vous en dites?
Bien, je pense que c'est un défi mondial quand on parle les défis de la santé. Et puis pour nous, il y a des grands défis ici dans le Manitoba. Et puis on pourrait ajouter la capacité dans notre système, puis au même temps respecter les droits des êtres humains dans les autres pays ici.
Puis un commentaire sur le décès qui a eu lieu dans un couloir dans un hôpital cette semaine?
Bien, c'est très triste. Et puis, nous savons qu'il y a beaucoup de défis dans les salles d'urgence dans la province. Alors, on n'a pas toutes les informations au sujet de ce qui est arrivé aussi, mais nous savons tous qu'il y a des grands défis que nous devons adresser tout de suite dans les salles d'urgence, dans les hôpitaux, dans les Manitoba. Et puis, ça doit commencer avec respecter ceux qui travaillent dans ces endroits.
Dernière question, les élections arrivent à l'automne.
Ouais.
si jamais le NPD gagnait l'élection, qu'est-ce que vous changeriez à tout ce qui se passe en ce moment dans le système de la santé? Qu'est-ce que vous apportez comme changement immédiat?
Bien, il y a beaucoup de choses qui doivent arriver, mais je pense que juste au niveau les personnes qui travaillent dans les hôpitaux, dans le système de santé, il y a un grand manque de respect avec les conservateurs. Oui, il y a beaucoup de questions de réseau et ressources et puis comment est-ce qu'on va livrer des services, mais parce que c'est un système qui est dirigé par des personnes avec des familles et puis des émotions, nous devrons recommencer la conversation au sujet de la santé de Manitoba avec un niveau de respect et puis avec un nouvel gouvernement dans la province.
Merci beaucoup.
Merci à toi.
Take it. Thank you very much.
Thank you.
No problem.